Welcome to the MS Gym podcast. I'm your host, Jody Feltham, and we have a treat for you today. So glad you can join us for the second part of our discussion with world-renowned Dr. Terry Wahls. In today's talk, we'll learn more about Dr. Wahls' role as a researcher as she shares about her upcoming randomized study titled Efficacy of Diet on Quality of Life in Multiple Sclerosis. Diet is often heralded as the key ingredient to managing MS symptoms. But with over a dozen MS diets out there, often that are contradictory to each other, how do we know which one is best? And is there really only one diet that's best for us all? This is one of the reasons this study is so exciting, as it's the largest randomized study about diet and MS. The outcomes of the study will be measured both with physical measures, such as blood work and MRI results, and also by patient-reported outcomes as well. I know we're all looking forward to seeing the proof in that gluten and dairy-free pudding. So grab your spoons and let's dig in.
So Dr. Wahls, let's get right to it with your study. That's why we're here. That's what we want to hear about. And you're currently recruiting. So of course we want to share that with our listeners. What is this study that you're recruiting for?
So our study is called Efficacy of Diet on Quality of Life in Multiple Sclerosis. We are looking for people with relapsing remitting MS who are between the ages of 18 and 70, who do not have clinically significant heart disease, liver disease, or kidney disease, because that complicates the study if we have people who have these complicating illnesses. We also can't take people who are on insulin or Coumadin. You need to be able to get to Iowa City. So that's in Iowa, in the central part of the state, central part of the country, for a baseline visit where we conduct walking assessment, hand assessment, a vision assessment, and a MRI. Then you'll be randomized to one of three diets. There is a time-restricted olive oil ketogenic diet that, non-starchy vegetables, meat, fish, poultry, and 2 to 4 tablespoons of olive oil every day. It's ketogenic, but we use olive oil, so it's very heart healthy. Then the other diet is the diet we used in the WAVE study. That is a paleo elimination diet that has a temporary restriction for nightshades, all legumes, all grains, so we can identify, do you have food sensitivities for a particular food, as opposed to getting food sensitivity testing. So that's the point of the elimination phase. We reintroduce ingredients one at a time to get your diet to the least restricted. And then there is the third group, which is the usual diet. So whatever you're eating, we want you to continue eating, but we will give you information from the dietary guidelines, and you'll get tips and resources from us once a month with cooking videos, cooking demos, recipes, resources from the dietary guidelines to help you improve your diet quality. At 3 months, everybody comes back for repeat lipids and clinical assessments. And then at 24 months, you come back for everything, which will include the MRIs. Our primary outcome is how we change quality of life and fatigue. Secondary outcomes, and we're very excited about this, MRIs, serum neurofilaments, clinical measures of walking, hand, vision function, and patient-reported outcomes of fatigue, quality of life, and mood, anxiety, depression. This will be the largest, because we're trying to recruit 156 people, longest, 2 years, randomized controlled dietary intervention study. We really do not know which diet will be better, the ketogenic diet, the paleo diet. There's reasons to think the ketogenic diet could be superior, and there's reasons to think that the elimination diet will be superior, because the ketogenic diet can be challenging, although as people get into it, it gets easier and easier, you're not hungry on the ketogenic diet. So anyway, our control diet, because we're giving people monthly tips on what they can do to be improving their diet, if our control group do in fact increase their non-starchy vegetables over the time, get rid of the added sugar, and in fact improve the quality of their diet over time, we could very well find that all three groups do improve over the 2 years, do very well, and that it turns out it's easier to help people improve their diet quality than we thought. Particularly when you have highly motivated folks who really want to do diet for their as part of their self-care routine. And I'll also say, if you happen to be in the usual care arm, it's probably an easier transition from what you're doing to a healthier diet than what you have in the 2 intervention arms. This is why we do the research. You don't really know what the question is. It's an interesting question. Can diet make a difference? Can diet lead to improved MRIs? This will be the first study that really begins to answer that question. So we're excited to be part of that. We don't know what we're going to find, but damn, it's exciting. I can't sleep at night because we're so excited about it.
That's incredible. It is very exciting. So these 3 different diets, are they all, or are any of them true Wahls protocol?
Well, the Wahls elimination diet it probably looks, well, let me come back. The Wahls protocol that I wrote about in my book, it really is much more comprehensive. It's a way of thinking about food. It's some targeted supplements, a stress reduction, and an exercise program. So is it really Wahls protocol? No, because we're just doing diet, and we're telling you don't add that other stuff unless your physician prescribes it. We've tweaked it. It's a little different than what I've written about in my book, because I do this radical thing known as read, learn, and make changes based on what I'm learning. So the study diet is slightly different than what's in the book. I'd say that's been improved. The ketogenic diet, as described, is different than what's in the book, but again, I think it's improved. The usual care folks, that's an interesting process, because we're telling people, follow your usual diet, work on improving it. We're going to give you tips based on the dietary guidelines, and it'll be interesting to see how that goes. So they're all close in that the underlying theme of the Wahls protocol is, oh my God, diet matters. Improve your diet according to what you and your family can sustain. So in that sense, all 3 are consistent with my underlying message of the Wahls protocol is diet matters. The food we eat becomes the body and brain we're going to have. So if you want a better body and brain, work on having a better diet.
Awesome.
Dr. Wahls, you said that in this study, it's randomized. So
yes,
each participant doesn't get to choose which diet.
Yes, and we have to. And let me explain why we're randomizing. Because one of the big questions people contact us, they want stress-relief to be able to choose their diet. Mm-hmm. And my response is, if you want that, you have to come see me as a patient. And well, I'm happy to do that. And I do have a clinical practice, so yes, if people want to come see me, you can certainly do that. For research, you need to randomize people between the 3 arms so that we can do a statistical comparison, group 1, 2, and 3, and draw some conclusions about that. If people are allowed to select, then there's bias involved. It's a very different kind of study that's called quasi-experimental. That's still useful as a preliminary pilot study. And we have done quasi-experimental studies. So that's a different kind of study design, but the evidence you get at the end is much weaker for changing clinical practice. The evidence we get at the end of this study, whatever it is that we find, will be much stronger in terms of what we can tell the MS public and what we can tell the MS practicing clinicians about the importance of diet. And because I think diet is so important, I want to have the best designed study. So at the end, we can have the best information, the best set of knowledge that we got from what diet could do for improving the MRI, what diet could do for improving walking, hand, thinking function, and vision, what diet could do for quality of life. And without a randomization, I'm not able to say very much about that.
At the end of this, when you get the result, the results come out, the study is completed, do you foresee yourself, based on the findings, writing another book about the results?
My publisher keeps asking for more books, so.
Or just revising and updating the
I think at the very least we would revise and update. And what I've done is revise and update about every 3 years. So the question will be, will I end up doing a revision before? Because it'll take 5 years for the study to be completed, and then it's another year for the analysis and to publish. So that would be about 6 years. Will there be enough data about diet, about exercise, stress reduction, and MS to update the Wahls Protocol? Absolutely. Now, we should keep in mind that I'm 66, and so, and I'm doing this study, so I'm in for working clearly till I'm 71. But I've told my family my intent is to live to 120, still thriving, still teaching, still professing here at the university. So could I fit in a few more iterations of the Wahls Protocol? Absolutely.
Awesome. I appreciate the fact that you recognize that just whatever you wrote in the initial book, whatever year that was, that you're not afraid to say, in the meantime, you've learned more, so you add that to it. You
got to keep tweaking.
You evolve.
We learn. We because I did revise my book. It came out just as the pandemic happened, by the way. And so I talked more about what we'd learned with the microbiome. I talked more about everything that we learned with fasting and fasting strategies. So I included that in the book. We talked about oxalates, talked about histamine. And then I also talked a bit more about electrostimulation of muscles. And people were, the first time I came out with my book, that was a very controversial point. Now, there are certainly more studies coming out saying exercise, everybody should exercise, even if you're in a wheelchair, it's vitally important. And even if you cannot walk, if you add electrostimulation of muscles and you work the muscles through electricity, even if you can't do volitional exercise, doing that work is anti-inflammatory. Doing that work in your muscles, electrically driven, improves the metabolic health, your blood pressure, your blood sugars, your blood lipids.
Are you talking about like TENS units?
Well, it's a similar kind of device. It is an electrical therapy device. It's a neuromuscular electrostimulation device. And so in my clinic, we use electrical stimulation, and I have partnerships with physical therapists that are very familiar, very comfortable with using electrostimulation as rehab with the goal of improving function as opposed to the goal of stabilization, getting people back to baseline. We don't accept that. Now, I warn people, if you want to improve function, now you have to be willing to have an athletic mind. And you're thinking rehab, and this is going to be more work than the athletes put in. And you can certainly improve function with the rehab mind, the athletic mind, exercise, electrostimulation, and a physical therapist, occupational therapist who will guide and support you. And it can be done. And I think the reason I had such success with my rehabilitation was I'm a former athlete. I found a physical therapist who had an athletic practice. And he saw the athlete in me and said, okay, I don't know what we're going to get, but let's go. Hurt like hell, by the way. But you know, I was an athlete. I was totally fine with that, because I also at the end felt just that endorphin rush, exhilaration, like, okay, I can do this.
Yeah.
And then I trained and to an extraordinary level. And again, and I think the reason I was willing to put in the hours and the training and the work was that history as an athlete. And so now if we find people who are willing to do and want to do rehab, I do outline that, yes, improved function is possible. It doesn't happen automatically. This is an athletic endeavor. And if you're up for doing athletic level work, even though I understand you're going to start with 2-minute, maybe 10-minute increments, we will get you hooked up with the right team to support that journey. And we've gotten people out of wheelchairs. I mean, I'm not the only one that's gotten out of a wheelchair, by the way.
So is there a deadline for
being in our trial? Yes.
Yeah.
So we have about another 18 months that we'll be recruiting.
Okay.
And keep in mind, it's 156 people. You have to have the diagnosis of relapsing-remitting MS, be age 18 to 70, and be able to get to Iowa City 3 times in 2 years.
Okay.
And you must be willing to be randomized to one of the 3 diets. And I think there's every reason to think that you could have great results from any of the 3 diets. I don't want people to feel discouraged, like, I don't want to be randomized. If you want to be in research, you have to be willing to be randomized.
Right.
And that will give you the tools in the control arm that you could improve your diet and get marvelous results as well.
Just so our listeners know, in the episode notes, we're going to be including links to the actual study itself where you can sign up. So Dr. Wahls will be providing those. We're also going to have links to her books, to her website, and anything else. Yeah.
And we are seeing patients. Yes, people can contact us to see patients. We have a screening survey that people will complete to make sure that you're eligible. And then if you're eligible, we contact you so we can get permission to get the records from your neurologist to verify the diagnosis. And then we'll get you scheduled into the system. Now, I've had people who are so excited that they complete the survey. We reach out, get them the CTO, that comes right back, bingo. And they've harassed their neurologist to get us the records right back. And they've been in to see us within a week. So that is possible. Wow. You have to really hustle to make all of it happen that quickly. Because usually, even if you complete your survey and you get the CTO, the consent to obtain information, so we can talk to your neurologist, back to us right away. The neurologist in clinic practice is usually very busy, and responding to researchers is not their highest priority.
Yeah.
And so it usually takes a couple of weeks to get the paperwork back from the neurologist. However, some highly motivated patients have, harassed their medical team to get them to respond to us immediately. Like, okay. So it can happen that you can get in right away, but usually it takes a couple of weeks to get through the process.
All right. Jody, do you have any more questions for Dr. Wahls?
You know what? She's answered more than I could have imagined.
I know. Like, she covered all of my questions. Like, I don't have any questions left.
Jody, I did want to tell you on the carnivore diet, the way to think about the carnivore diet is that's a very potent elimination diet in terms of eliminating potential dietary antigens. What I've seen in clinical practices, people can do really well on the carnivore diet. I want to caution them to not eat quite so much liver. Some of the carnivore diets tell people to have a pound of liver a day or a week, and you could end up with overload of retinol. If you decide to come back to having more vegetables in your diet, you'll probably have to do that in a very gradual fashion. It can be done, but we've had to help people very slowly reintroduce vegetables. And fermented vegetables may make that a little bit easier, because part of what people because you have to slowly adjust your microbiome to handle the vegetable material.
Okay, thank you for that advice. I appreciate that for sure.
For those tips, because we have certainly many people experimenting with the carnivore diet. I've thought about experimenting with the carnivore diet, but I don't want to, because occasionally people go on the carnivore diet, really struggle to get back into the vegetable, and so I was like, I didn't want to risk it. I mean, I was curious to see how it would go, but like, I just did not want to risk the potential to have difficulty coming back to my usual diet. Because otherwise, I like experimenting the various dietary patterns that are out there.
Well, Dr. Wahls, thank you so much for coming on today. Hopefully we will be able to get some recruits for you.
That would be lovely. And Brooke, if I could request that I get to come back and chat with you in about a year, because then I could tell you, how recruiting's going and try and get another surge of recruits from your wonderful tribe.
Absolutely. We look forward to it. How about it, Jody?
I agree. And I was talking to Brooke before. I said, I think this will probably be our most downloaded episode.
Yes.
For sure.
That would be wonderful.
Because we on the podcast, we try to avoid talking about diet. We really do, just because it's so subjective. Not everything works for everybody. Plus, the MS Gym is all about movement and neuroplasticity. So in the past, we really have kind of like tiptoed around diet. But during one of our summits, we did a session on diet and then turned it into a podcast. And to date, this is after 2 years, it is one of the most downloaded podcasts that we have. And we've polled people, what do you want to hear about? Well, they want to hear about diet. Like, it's number one on the list.
Oh, absolutely.
So if they don't get something from today, that they're not listening.
They're pre-contemplative, as we would say, pre-contemplative. They'll maybe when I come back next year, they'll be in a better place. They'll be ready to hear the message, because often we have to hear messages several times. And then finally we go, I think there's something to that.
Right. Well, Dr. Wahls, thank you so much. And we will be in contact, and good luck with your study.
Bless you. Thank you so much. Thank you, Jody. Thank you, Brooke. Much love to all the great work you are doing.
Thank you, and take care.
All right. Bye-bye.
Bye.
We hope that you enjoyed this 2-part summer series with Dr. Terry Wahls. To learn more about Dr. Wahls and her upcoming study, please check out the show notes for more information. You can connect with us here at the MS Gym through Facebook, Instagram, or visiting us at themsgym.com.